All right, so this lecture is on assessment and screening. The notes can be found in Canvas, as always. There's information missing from what I uploaded, so you'll need to pay attention to this lecture and fill in the blanks as I go along. If you can't understand something I'm saying or I start going too fast, just let me know via email or in class, and I'll be happy to provide you with the information that you've missed. Okay? So, what is the purpose? Well, the purpose of assessment and screening is to really establish a baseline. And with that baseline, you can judge progress. It also helps you to detect physical weaknesses, also strengths, so you can develop a program that best suits your client's needs. And also, it can be used to enhance motivation. So, if a client can see that they're improving, for instance, maybe on day one they came in and they could only do 1 or 2 push-ups, but let's say 10 weeks later they're able to do 10 to 12. Those kinds of things can enhance motivation. So one of the first things you want to do is to identify your client, and that includes getting their chronological age, just so you know where they fall. But we already know that biological age is a better tool than chronological age. And just to refresh, biological age is a process or group of processes that cause the eventual breakdown of homeostasis with the passage of time. Keep in mind, that a simple observation of someone's physical appearance doesn't provide much information about their functional capacity. So you do need biological age. Another way to identify your patient is to try to get some idea of their rate of aging, and that's the change in function of organs and systems per unit of time. And this typically we find a linear relationship. So as time goes on, function goes down. But keep in mind that non-normal circumstances can impact the rate of aging. And then finally, you want to examine their ADLs just to see, what they're able to do on their own, what they struggle with, and perhaps you can develop a program to help them do better with some of their ADLs. When you're identifying your client, you also might want to use a classification schema just to identify where they are. So if they're level 1, they're considered healthy with no evidence of disease. If they're level 2, they're considered ambulatory, but they're not active. So they have no major medical problems to report, but they never participated in a structured exercise program, so you still want to kind of ease them in. And there's a level 3 where the person is ambulatory. They have some evidence of disease failure. They've been diagnosed perhaps with severe coronary artery disease or arthritis. Let's say they could have diabetes or chronic obstructive pulmonary disease. Then there's level 4. And these people are considered to be frail elderly, and they rely on partial assistance from professional staff or a caregiver for help with their ADLs. And then there's level 5 where the person is wheelchair bound and they rely on complete assistance from a professional staff member or caregiver for assistance with their ADL. And I think I've already cleared this up, but I do want to just say again, in your book, when they talk about ADLs, they call them BADLs, which is basic activities of daily living. It's the same thing that we've been talking about with ADLs. Okay? They also, I think, mentioned in the book something about AADL, and that kind of refers to recreational, occupational, and community services, or their functional ability to do those. Okay? So always keep in mind that an evaluation of ADL capabilities can help you understand what a person can actually do, and also how to design their programs best to meet their needs. And so I mentioned that in the previous slide, but that's really important. Before you start exercising or helping the client with exercise, you definitely want to do a pre-exercise interview. The reason for conducting this is to be able to establish a rationale in a calculated exercise program. So some of the key questions that you can start with that are considered like non-threatening are things like, tell me about a typical week in your life. Are you still working? Are you retired? Do you consistently face stairs, lifting, or walking? And if so, are any of those tasks difficult for you? Do you experience any pain during movement? Have you ever fallen? And if so, what were the circumstances? And falls are very frightening for seniors. And so if they've had a fall in the past, it's really important to know what caused that fall and try to help them understand that you're going to help them avoid a future fall. Falls can lead to breaks and other things like that, which can send some seniors on kind of a downhill spiral. So if a senior falls and breaks their hip, that could land them in a nursing home, and they can see that that's happened with their friend, and so they're terrified of falls. and so they will do everything they need to do to try to avoid a fall, and that could prohibit them from engaging in your exercise program. And so you have to really reassure them that this is going to actually strengthen them and help them to prevent falls, and that you too are aware that falls can occur, and you'll do what you can to help them avoid one. And then the final question is, how often do you walk? Was it a brisk walk or a stroll? Resnick and colleagues also developed a health screening tool that's specifically for older adults that can help you as a health and fitness professional identify different types of exercise and physical activity programs. And the screening tool is called the EASY. It's the Exercise Assessment and Screening Tool, or Screening for You. So basically, you ask them, do you have pain, tightness, or pressure in your chest during physical activity? Do you currently experience dizziness or lightheadedness? Have you ever been told that you have high blood pressure? Do you have pain, tightness, or swelling that limits or prevents you from doing what you want or need to do? Do you fall, feel unsteady, or use assistive technology devices while walking or standing? And is there reasons not mentioned why you'd be concerned about starting an exercise program? So keep in mind that these pre-exercise screenings are the best way to continue to gather information about the older person's needs. If you ask them about their blood pressure and they say they haven't had it checked in the past 6 months, you want to encourage them to go get it checked. If they're using assistive devices like a cane or a walker, it's okay to work out with them to have them exercise. Just have them use the tool when necessary. Okay. And then while these questions help you, the professional, gather information, it can also be helpful for seniors in that they might learn or recognize signs of a problem. So if they're starting to feel dizzy or lightheaded during exercise, or have pain or tightness or swelling as a result of exercise, and they might report that to you or their doctor. Okay? And this can also start good conversations about safety. There's also a risk stratification. So if you want to, classify your client's risk, then you could use this tool. There's low, medium, or high risk. This table is also in your book. It's table 5.2. So basically, they would get 1 point for these positive risk factors. So if their age is just a certain number or higher, that may be considered a risk factor. They have a family history of some kind of problem that is risky for exercise, maybe cardiovascular or whatnot, that gets a point. If they're smoking cigarettes or they have a sedentary lifestyle, you also get a point for that. You get a point taken off if you have a high serum HDL, which is the good level of cholesterol. Okay, so you have their points, and then you can see where they fall in this risk stratification. So if they have low risk, that means they have no symptoms and they have one or less total risk factors. And according to this classification, they don't need any medical exam or doctor supervision for exercise. I would argue that it's always best to err on the side of caution and always have a medical exam and be under doctor supervision for working out. But certainly if they have moderate, then you would need to get a medical exam for more vigorous exercise and also have a doctor supervision for vigorous. Now if they're high risk, then you need a medical exam for any type of exercise, moderate or vigorous, and doctor supervision. Okay, but again, if you're working in some kind of fitness center or as a therapist or whatever, you're probably going to have a medical exam and doctor's supervision regardless. So there's also a pre-exercise screen and continuation of all these other things that you're gathering, where you might want to identify, health conditions and risk factors. You want to identify any contraindications for exercise. So if they have had a heart attack maybe in the last month or whatnot, that's a contraindication. You also want to be able to design and evaluate individual programs. You have to gather as much information as you can so that you design an appropriate program. You also want to make sure that you're adhering to legal and ethical requirements of the industry and of your place of work. And then also, this kind of encourages open communication between you and other healthcare professionals that work with your client. So you might need to speak with your cardiologist to make sure that it's okay for them to do whatever it is you have planned. Or if they're coming to you for personal training, but they've been to a physical therapist, you might want to speak to them about what they've been doing with the client. Okay? So in addition, there are some pre-participation forms. So the informed consent. This is acknowledgement of risk associated with the activity. You want to review it verbally, although you're going to give them a paper copy to take with them for their records. And the purpose of this is to explain the purpose of the exercise or whatever it is you're doing and the test, and also explain their risk and potential benefits, any alternatives that are available to them, explain that their information will be kept confidential. It's only used to help them, and they can ask you questions at any time, and they are free to say they want to participate or not, and they can end their participation at any time. You also have the agreement to participate, and that protects the fitness professional from clients claiming to be unaware of potential risks. So they've agreed to participate in this, and they've reviewed all of the purposes of the exercise and the risks and benefits. Then you're going to want to do a health history questionnaire that gives you more detailed medical and health information. Then you maybe have a musculoskeletal health questionnaire, again more detailed information about musculoskeletal health, perhaps osteoporosis or osteoarthritis. Then there's something called the PAR-Q, and that's Physical Activity Readiness Questionnaire. It's 7 questions to give you an idea of how ready this person is to engage in exercise. If they're not really ready, then you might have to go back to what we talked about when we talked about motivation and adherence, and try to motivate that person to get ready to exercise. You also might want to learn more about their exercise history and attitude questionnaire. So what have they done previously? If they've been very active in their lives, then that can help you learn like what type of activities they like or dislike. But also that could help you. Okay, so sorry, I had a student call and I got distracted. But I think I was down to medical release, and that provides a fitness professional with the client's medical information and explains physical activity limitations and or guidance from their physician. Okay. So the next thing you should know when you're asking your clients about their medications, it's really important to understand how pharmacokinetics works and how there's changes with aging. So pharmacokinetics refers to the absorption, distribution, metabolism, and excretion of drugs in the body. It's important to know, as I just mentioned, that with age there's some changes. So the first one is there's a decrease in lean body mass as body fat increases. All of these affect absorption, distribution, metabolism, and excretion. And the second one is there's reduction in total body water, and that increases the risk for toxic effects. The third one is decreased efficiency of the GI tract, and so that leads to slow and less complete absorption, so there's more of the drug perhaps circulating in the body. Number 4, there's decreased cardiac output, so your heart's not pumping as strong as it used to, and so there's less efficient drug distribution and elimination. And then finally, there's decreased efficiency of the liver and kidneys, so that leads to slower and less complete metabolism of drugs, and increases the chance of adverse effects. So these changes profoundly affect the distribution and elimination of drugs outside the circulatory system. And so older adults tend to have prolonged effects of certain medications. And there are specific ones that are worse than others. And so for prescriptive medications, those are things like antihypertensive medications, so medications for blood pressure, for high blood pressure. Those medications can actually cause hypotension or low blood pressure, or decreased heart rate. So with the low blood pressure, if the person is exercising now after having been kind of sedentary for a while, then one of the benefits is reduced blood pressure. But if they're taking a medication that reduces their blood pressure and then they're exercising, the blood pressure might kind of bottom out. And so that could cause dizziness or things like falls and things like that. Also, the purpose of some antihypertensive medications is to decrease their heart rate. So you as a fitness professional might have a harder time getting their heart rate up into their target heart rate zone for the workout. So you just have to be aware of this and perhaps maybe not push that person so hard. Maybe they can't get into their target heart rate zone while on the hypertensive medication. Okay. The anti-Parkinsonian medications, these things can cause numbness, increased hand shaking, dizziness, confusion, unusual or uncontrolled movements of the body, hallucinations, and blurred vision. And so as you can imagine, any of those could be problematic while doing exercise. Then there's psychotropic medications. These are things like sedatives and anti-anxiety medications. They can cause shakiness and unsteady walking, trembling, some drowsiness, as you could imagine, and then problems with muscle control and coordination. So again, any of those symptoms could be problematic for exercise. Then there's some over-the-counter medications that you want to be aware of, and those are things like aspirin, which could cause hypotension as well, confusion, sometimes hearing loss, problems with stabilization of blood sugar levels, and they can be very dangerous when they're mixed with blood thinners like Coumadin or Xarelto. That could actually cause a fatal hemorrhage. So if the person injures themselves, they could actually bleed to death if they're taking aspirin, okay, with a blood thinner. Then there's multivitamins, and sometimes those just interact with other medications and can amplify the effects of certain drugs. Calcium can cause confusion, increased urination, loss of appetite, sometimes mental or mood changes, nausea, weakness, and vomiting. And acids like Mylanta, or maybe even Pepsid or those kinds of things can slow reflexes, which could actually be quite dangerous when exercising, and also cause some muscle weakness. And then there's antihistamines, which things are used for like allergies or if they've had some kind of allergic reaction to something that can cause drowsiness, confusion, and dizziness. So there's a table in your textbook, Table 5.4, which you might want to review, which has some of these medications. So in addition to those ones that I just mentioned, there's also complementary and alternative medicine that you want to ask about specifically. Don't ask them about CAM, just ask them about anything else that they're taking, any supplements or any kind of meditation or breathing that they're doing. So you could ask about diaphragmatic breathing, progressive muscle relaxation, meditation and mindfulness, acupuncture, and then a whole list of dietary supplements. And the reason you wouldn't want to say, are you taking any CAM, is that they probably won't know what that means. But if you list off some possible, medications or supplements, then they might know and be willing to disclose that to you. And it's important to know these because they can impact other medications, or they have their own set of side effects as well. So let's move on now to the physical assessment. So before you actually complete the physical assessment, you want to give a couple of reminders. You want to remind your client before they come in to dress in comfortable clothing, wear comfortable shoes, preferably shoes designed for walking, use walking aids if needed, such as a cane or a walker, eat a light meal before early morning or afternoon tests, and avoid vigorous exercise within 2 hours prior to testing. Okay. So when you're actually doing the screening, some of the physical tests you might want to do are a blood pressure screen. You might want to check their body composition, their heart rate, and then rate of perceived exertion. For blood pressure is defined as the force of blood descending the arteries. It's measured in millimeters of mercury. It's divided into two numbers. You'll have the top number, which is systolic, and that represents the maximum pressure created by the heart during a ventricular contraction, and the bottom number, which is diastolic, and that's the minimum pressure that remains in the arteries during the filling phase of the cardiac cycle. And so we've already talked about high blood pressure, and that's called hypertension also, and then low blood pressure is known as hypotension. Okay. So how do you measure blood pressure? You need a blood pressure cuff, a chair, because you want the person to be sitting in a stethoscope. If you're going to do it the old school way and not use the automatic machine, you're going to listen for specific sounds, which are the vibrations of the vascular wall. And so the first sound you hear is the systolic number, and the last audible sound is the diastolic number. I don't know how to do a manual blood pressure check, so if you have questions about that, you can probably look it up online, or I can get you more information if you need it. It's also just important to keep in mind that cuff size is really important. So you might actually have an adult who's so petite that they need a pediatric cuff, or they could just use the adult cuff. And then sometimes you'll have an adult who has a larger arm and they might need the extra large cuff. So if you're not using the proper cuff size, you're not going to get a proper reading. So that's why cuff size is so important. This is just a chart that tells you about normal blood pressure. In the green, anything less than 120 over 80. But you don't want to get too low either. And then the yellow is the pre-hypertensive area. You really don't need to get concerned. I mean, having a high blood pressure stage 2 is not good, or stage 1. But you really need to worry about calling 911 if someone comes in with something higher than 180 over 110. That's considered a hypertensive crisis, and emergency care is needed because they're at high risk of having a stroke. Okay, so the other thing you might want to measure is heart rate. And heart rate is the number of times the heart contracts in a minute. So how do you measure it? With beats per minute. So what you can do is count the number of beats for 30 seconds and then multiply that by 2. Keep in mind that this can be inaccurate, so you might want to do multiple trials. So where do you measure it? On the wrist or on the neck? Okay, and so I can't really show you right now. If you press your 2 fingers on the wrist, kind of poke around there, you should be able to feel your pulse. And the same thing on your neck. Not in the center, a little off to the side, you should be able to find your pulse there as well. Another place is on the ankle or the groin, although you probably wouldn't want to use either one of those on your clients. Why is it important? It provides an estimate of exercise intensity. So you want to get an idea of where they are, their resting heart rate, and then maybe check it a couple times when they're working out to see how their heart rate is either going up or staying the same. So a resting heart rate should be somewhere between 60 and 100 beats per minute. If it's too slow, that's less than 60, that's called bradycardia. If it's too fast, that's tachycardia, and that's something over 100. If they're having either one of those, then you might want to have them go to their physician for a checkup. Okay, and the next thing you might want to measure is body composition, and this refers to the overall makeup of the body's total mass. So this determines the relative percentage of lean body mass and fat body mass. So there's a variety of measures for you to do this, and the first measure, you could use the body mass index, which we're all pretty familiar with, where you divide the weight in kilograms by the height in meters squared, and then you look at a chart to see where they fall. The advantages of this are that it's easy to administer, it's non-invasive, and it's inexpensive. Disadvantages are that it fails to identify different body types and fat distributions. Okay, this can be an okay option for seniors. The next one is the waist to hip ratio, and this determines the distribution of fat storage above and below the waist. So basically, you would take the circumference of the waist at the level of the belly button and divide by the circumference of the hips at the point of greatest protrusion. The advantages to this are that it's non-invasive and inexpensive. Disadvantages are that it disregards body type similar to the BMI, and sometimes there's equipment error. Okay. The third one is the skin fold measurement or skin calipers. And this measures the width of subcutaneous fat at various sites. So maybe at your tricep or your bicep, subscapular. And the advantage to this is that it's quick, easy, and cheap. The disadvantage is that seniors might find it uncomfortable having their skin clipped like that, and sometimes there's inaccuracy between different people measuring. Another one is the bioelectrical impedance analysis. You've probably seen this at a gym or maybe even in class, one of your other classes. It's a handheld device, or sometimes they will have a scale that you step on. It measures the impedance or resistance to a signal as it travels through the body tissue. So the more muscle a person has, the more water their body can hold. So the greater amount of water in the person's body, the easier the current to pass through. So the more fat, the more resistance they will have. Advantages are it's inexpensive and it's portable. Disadvantages are it's not accurate, and dehydration can actually throw off the measurements. Okay. Then there's something called the bod pod, and this measures the amount of air the body displaces within the chamber. So it measures a change in volume. The advantages is very accurate. The disadvantages is not easily accessible. You have to have minimal clothing on. You have to be in a confined space, and it's expensive. So as you can see here, maybe the disadvantages outweigh the advantage. A fifth option is hydrostatic weighing, and this determines body density with water displacement. You weigh somebody on land and then have them blow out all the air from their lungs and submerge the person underwater. Typically, you do this 3 times, and then you use some kind of special calculation to come up with their composition. The advantage is very accurate. The problem is they have to hold their breath and remain underwater. There's a sixth option. It's a DEXA. It's a dual energy X-ray absorptiometry. This is the gold standard. However, it's more commonly used for to measure bone mineral density, so for like osteoporosis and things like that. It uses two X-ray beams that go through the body, and it can also determine, but it can be used to determine body composition and fat content. The advantage is that it's most accurate, it's non-invasive, however it's extremely expensive, and most people aren't going to let you use it for body composition and fat content measurement. They're going to stick to what it's typically used for, which is bone mineral density. So basically for body composition, you kind of just have to use what's at your disposal. So whatever your company has, a BMI, is fine. So you also want to measure the rate of perceived exertion, and this is an exertion scale that was developed to determine an individual's intensity during exercise. So it quantifies one's feelings and sensations during the stress of physical activity. So there's two scales, the original or the Borg scale, which goes from a 6 to a 20, and then they have the new scale, and that's from 0 to 10. That's a modification of the Borg. Basically, people are having a hard time identifying like a 6 being, no effort at all. So they changed the new scale to a 0. So this is the old scale where you can see they're starting at a 6, which means no exertion at all, and then a 20, which is maximal. This is a new scale, which is a 0 to 10, where you can see 0 would be no effort, and 1 is very light activity, all the way up to 10, where you're giving your maximal output. Okay? Alright, so there's some functional tests in addition to the physical tests that you might want to do. There's a talk test. We'll go over these things individually. So the rationale for functional tests is that these are quick and easy to administer. They require minimum equipment. It can be done without a medical release. They're safe, sometimes enjoyable, and you don't need to be a certified practitioner to administer them. So the first one up is the talk test. It's a method used to measure exercise intensity by judging your ability to talk while doing your workout. So the benefit is this requires no equipment and it's quick and easy. So someone would be considered to be doing a light intensity exercise if they're able to sing while being active. They would be considered doing a moderate intensity exercise if they can talk but they can't sing. And then finally, it would be vigorous if they're unable to talk more than a few words or carry on a conversation. Okay? There's a Fullerton Advanced Balance Scale. The purpose of this is to test both dynamic and static balance under varying sensory conditions. It is designed to measure balance in higher functioning active adults. There are 10 items. You receive a score of 0 to 40, with higher scores being better. Item scores on a scale of, are scored on a scale of 0 to 5. In order to do this test, you would need to have a stopwatch, pencil, a 12-inch ruler, yardstick, 6-inch bench, masking tape, and 2 foam pads, and a metronome. Okay, there's also the Senior Fit Test, which was developed by Rickley and Jones. It's a simple, easy-to-use battery of test items that assesses the functional fitness of older adults. So this assesses key physical ability needed to perform common daily activities. So you would ask a person to do a 30-second chair stand, arm curl, 6-minute walk, or a 2-minute step test, back scratch, 8-foot up and go, and you also measure their height and weight. Another test is the multi-directional reach test. The purpose of this test is to determine the limits of stability on an individual to lean in a forward motion, backward, and then both lateral directions. Equipment for this, you will need a yardstick and a wall. A person can choose the arm of their choice if they want to be moving. The feet have to remain flat. If they move their feet or their feet aren't flat, then the trial is discarded. Typically, you will do 3 trials and then take the mean. And then you want to look and see what kind of trunk, hip, and ankle movement strategies they have. And this can be modified. You can have the person sit in a chair if necessary. Okay, coming into the home stretch, there's the Berg Balance Scale, and the objective is to measure static balance and fall risk in the adult population. So there's 14 items. It's scored on a 5-point scale of 0 to 4, where higher scores indicate lower fall risk. More commonly used to evaluate lower functioning adults. The test does encompass everyday activities such as reaching, bending, and transferring, and it can be modified for higher functioning individuals, but you just kind of eliminate the first 5 items. Okay. And then finally, I think this might be our last one, with the Tonetti Gait Evaluation. And the purpose is to assess the biomechanical patterns of walking. It tests 7 facets of gait. Items are scored on a 3-point scale, 0 to 2. A score of 12 or above is minimum or no fall risk. Lower score, the greater the risk. The equipment that you'll need for this are a stopwatch, shoebox, 2 cones, stairs with railing, and a level walking surface. So there's more information about all these tests. I know I went through them quickly in your textbook, and they also go over some other tests that I probably didn't mention here. So it's important that you read the chapter. Once you're done with your assessment, you come up with a post-assessment report. So you're going to make sure you have consent from the physician to move forward. You want to discuss the effects of the test performed with your client. They're probably going to be nervous, thinking that, oh, I didn't do well, or I could have done better. And so you want to go over these and be realistic with the person. And then also follow up with the client in a few days, after you've come up with their program, and then go ahead and get them started. Okay? So that's all that I have for this assessment and screening lecture. Again, if I talk too fast or you couldn't understand what I was saying because I have a cold and nasally, just ask me, and I'll be happy to give you the information that you missed.